the Maria Holder Diabetes Center.
Managing diabetes means treating the whole patient, not just blood sugar.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
Good afternoon, Q family! This is Peter Boyce here in your Q Afternoon, bringing you 15 diabetic-friendly minutes on your favorite station, 100.7 QFM, all with the compliments of the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, and the Maria Holder Diabetes Center.
And what is we focusing on in today's show?
You know, last week we focused on your heart.
I remember that.
Well, today is International Podiatry Day. Yes, International Podiatry Day is celebrated annually on October the 8th. That is today. And this global day aims to promote podiatric medicine to raise awareness about foot health and highlight the vital role podiatrists play in overall health and well-being. And you know, there's a podiatry department at the Maria Holder Diabetes Center located in Warren, St. Michael to help you take care of your feet. Whether you're a diabetic or pre-diabetic and listening to QFM right now, it is important to take care of your feet. From the time you get up in the morning, you're using your feet. You use your feet to go to work. You use your feet for line dancing at Q in the community. You need your feet for a lot of things. So with that said, today, International Podiatry Day, we are going to start this show off by going into the foot corner with Dr. Diane Bradford, aka Dr. D. Let's see what the doctor is talking about today.
I thought today that we talk a little bit about the foot. I wouldn't say necessarily always challenged, but I'm always intrigued by the diabetic foot because there's so much that goes on in it. And I think that there's so much that people don't actually realize. So remember that we have now expanded our services in the foot clinic, and I'm going to call this little tidbit the foot corner. So welcome to the foot corner. We are a podiatry led foot team. Then of course we have our nurses, Nurse White, Nurse Bassoon, and Nurse Bascom, who can help you with the queries, as well supported by your doctors, me, Dr. B, Dr. Level. So I wanted to talk about common foot deformities because people don't think about this. People look at their feet and just assume, oh, that's just how I am. So first of all, you have something called hallux valgus. And this is when almost like the big toe or your forced toe starts to bend inwards, and sometimes you get like a little bit of a bunion and that kind of stuff. And people think no problem at all. No. If you leave it untreated, the deviation can get kind of more and more, and it can actually cause a problem whereby you have crowding of the toes and then the toes overlapping each other. Another common deformity is something called a claw toe. Bend your finger like a little claw, and you can imagine what I mean. So that's abnormal bending, or what we call plantar flexion of the front part of the toe, also the back part as well of the toe. Then they have something called hammer toes, and this is when the bending becomes even more, and you'll find the toe literally almost like hits into the ground. We call that hammer toe, and usually when it reaches this stage, the toe actually can become almost a little bit rigid and not straighten back out as easily. You will also find that the top of the toes will become what we call prominent, or they'll be like sticking up in the air, and we call that prominent metatarsal heads. And I'm saying all of these things because they're relevant, because what happens is when you put a foot with a deformity into a normal shoe, you're at an increased risk of getting callus, bruises, and ulcerations. And in its worst scenario, we're thinking about something called a Charcot foot or a rocker bottom foot, and that's when the foot actually loses some of its structure. So many of these things are due to nerve injury, which can happen over a period of time due to high blood sugars. It's also due to changes in the muscle and tendon structure that can happen in the foot. When you have diabetes, the higher sugars can cause stiffening in the tendons, and therefore you can have these kind of changes with very stiff, shortened tendons pulling on the toes and pulling them into abnormal positions. And then you can also find that you're suddenly developing a high arch, and as we said with the Charcot foot, that's when you have severe nerve loss. You may actually find that the arch actually drops completely. The other thing that I like to remind people is that your foot as you age is not the same foot that you had when you were 25 in terms of its shape, its size, its structure. So always make sure that you have correct footwear. If you're unsure what that correct footwear should look like for you, or if you need extra support or extra padding, please contact us in the foot clinic. We'll be able to advise you as to what you need so that you make sure that you are bearing the weight properly through your foot and you're not generating high pressure areas. If you need information, please feel free to visit us and to have a foot assessment, and we'll give you the best advice that we can give you and point you in the right direction so that you can continue to take care of your feet regardless as to what is happening with them presently or what has happened in the past.
Thank you, Dr. Diane Brathwaite, as we celebrate today International Podiatry Day, for that information on taking care of our feet at the Maria Holder Diabetes Center. Remember, there are not only feet at the center, but you can also get an eye screening for diabetic retinopathy. You have to do that every year once you are diabetic, so don't forget that. You can also get a vascular screening to check to see if you might have bad circulation, like if your feet swelling up and thing. Make an appointment at the Maria Holder Diabetes Center. And if you're thinking that
I would like to lose some of this weight, especially Christmas coming soon,
or you would like to get some advice on what you need to eat in order to remain healthy, call and make an appointment with dietitian Victoria Cox. The number for all those appointments, 417-0305. But today, International Podiatry Day, we continue to be feet focused. So we are going to go to the podiatry department of the Maria Holder Diabetes Center, and we are going to talk to Nurse Bissoon. Introduce yourself, Nurse Bissoon.
My name is Melissa Bissoon, and I've been a registered nurse since 2004, and I've been at the Diabetes Foundation since 2018. A very nice experience. As nurses, we do podiatry and we do the medical side of it to the extent where, like, that's blood pressures, taking your HbA1c, which is also a diagnosis upgraded to diagnosing with diabetes as well, and stuff like that. I really concentrate a lot on podiatry. While here, have been here, Dr. Brathwaite did invest in me alongside the podiatrists.
How important is podiatry to diabetics?
Absolutely important. Basically, is saving feet. And with saving feet, you need to get it, you see that golden era? That's that golden space. So if I can get you to assess your feet, I don't need to wait on a cut or bruise. I need to put in my education with you individually as a diabetic. So then when you start with education and home therapy and then get into the nearest hospital setting as soon as possible, you start there saving feet from that moment right forward. Very important. Very, very important.
What exactly is the golden moment?
The golden moment is when you get it as soon as possible. Or I home and I say, well, I can wait 3 days to see what happened. You're escalating your, I would say, damage, putting yourself out there. Don't want to go so far as to say an amputation, but you're making the ulcer or whatever worse. You feel you can get better, but that don't mean anything because you're a diabetic. Your healing process is different. We don't know if you had a tetanus injection. We don't know the severity of your controlled or uncontrolled diabetes. So we need to get everything done as soon as possible. So that's why we tell patients, as soon as anything happens, just come to the nearest hospital, center, wherever, GP, public care. We have public care in Barbados. So Winston Scott, we have the tertiary institution, QEH, the Diabetes Foundation. Come on. Don't waste no time.
Thank you, Nurse Bassoon, for that good foot information to keep us on our feet as we celebrate today International Podiatry Day. And you heard Nurse Bassoon talk about the golden moment. Well, for our Q song of the day, we are going to go into the Drifters with This Magic Moment. Compliments, the Maria Holder Diabetes Center.
This magic moment,
The Maria Holder Diabetes Center.
so different and so new, was like any other until I kiss you, and then it happened. It took me by surprise. I knew that you felt it too, by the look in your eye, sweeter than wine, softer than the summer night. Everything I want, I have, whenever I hold you tight. This magic moment,
The Maria Holder Diabetes Center.
while your lips are close to mine, will last forever, forever till the end of time. Oh, oh, oh.
Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937.
We now welcome to the Maria Holder Diabetes Radio Show a patient of the Diabetes Foundation, Miss Deborah Carmichael. Welcome to the show, Deborah.
Yes, thank you very much, Peter Boys.
How long have you had diabetes, Deborah?
I only found out a couple years back that I was staying in the hospital. I had to go down there 5 days a week for get tests early on morning when for me, and then they come for me home in Story Gap and climb me in front of the Scott Polyclinic at that place. And they tell me that I was a diabetic.
So tell us about your experience at the Maria Holder Diabetes Center.
My experience that from the time I've been up there, the foot began to improve a lot, heal and everything. First, I want to thank Marlon that has worked there, Melissa, Gloria, and Miss Bascom. They deal with my foot a lot, and I want to thank all the workers that deal with me, Dr. Prophet, Dr. Lavelle. I want to thank all the workers from there that they did it very nice to me. I will ask anybody that want the whole body healed to go to the diabetes center.
So what did they tell you that helped you with your diabetes? Did they also tell you about changing your diet and those things?
Yes. Cut down what I eat and everything, and lose a lot of greens. They don't buy juices and things that I will invite anyone that want the foot heat, any part of their body heat. Please go to the diabetes center. Cause I have my foot for years. I had the foot. Used to pain me, used to make me cry. All kind of things. Can sleep when night come. All kind of things. But now I get to find out that I didn't even know that there was a diabetes center back at Warren's Clinic. The Marlon that is right there tell me we don't come to the diabetes center, and I went there for March. And I find a lot of improvement with your feet. You understand? So I would beg anybody to go to the diabetes center.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments, the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care.
1 in 3 adults with diabetes also has high blood pressure. Don't ignore it.
The Maria Holder Diabetes Center